Now, I don't know how many people here know this, but your muscles are important. They're important for controlling your blood sugar, breaking down fat, and most simply, crucial to undergoing any daily activity. So from this, it's logical to say that maintaining your muscles is also important. But how does one maintain your muscle? Well, it's typically recommended that one undergo high-intensity exercise to do so, which is fine for most people like you and I. But what about the groups of people like the elderly or the rehabilitated? These people aren't doing high-intensity exercise. It'd be too challenging, and for some, it could be harmful. So there's a problem that exists here, because we have these groups of people who are mobilized for long periods of time, and consequently are at high risk of their muscles breaking down. Because if you don't use them, you lose them. So knowing this problem, it's very intriguing that several studies have come out recently to suggest that low-intensity exercise can produce the same muscular adaptations as high-intensity exercise when blood flow is cut off to the muscle. And this is called blood flow restriction training. And it's cool because now these groups of people don't have to undergo high-intensity exercise to maintain muscle. They can undergo low-intensity exercise with blood flow restriction. And that's doable for them. But let's take it a step further. What about the group of people that are so highly immobilized or so highly weak that they can't even undergo exercise at low intensity, like post-operative patients or for stroke patients? Now, in the past, to prevent muscle breakdown in these groups of people, a technique called electrical muscle stimulation has been used. And for those who don't know, electrical muscle stimulation is actually a generation of electrical current that goes into your muscle, and at a high enough intensity can actually cause a visible muscle contraction. But its effectiveness at maintaining muscle is unproven. And it's unproven because in order to cause such a high degree of adaptation that would be effective, you have to turn the electrical intensity up so high that the pain would be unbearable for people. People wouldn't do it. So knowing this problem, I thought, well, why not combine blood flow restriction with electrical muscle stimulation? Because blood flow restriction allowed for lower intensity exercise to produce significant muscular adaptation, so why can't blood flow restriction allow for lower intensity current to produce significant adaptation in the muscle? So that's what I'm going to do. I'm going to combine blood flow restriction with electrical muscle stimulation, and I'm going to assess examine the changes on the arm and on the leg. And to assess the efficacy of this, I'm going to track the changes in muscular strength and muscular size over 6 weeks. Now, data collection has just started, but I hypothesize that I'm going to see a big change in the group of people with blood flow restriction compared to the groups of people without. And I'm excited to see what happens, because this research is new, and it's innovative, and it could greatly impact and benefit those who've lost their mobility. Thank you.